All right, welcome to Season 3, Episode 10 of the 6 Lessons podcast. Today we're going to be talking a little bit of history, and the history will center around how research from one field spills over to another field. So this episode talks about how we have what's called heuristic knowledge. And so heuristic knowledge means if you do one thing and you do it really well, it might help you to do something else that's not related. For example, music, near and dear to my heart. I'm not a musician. I sing in choirs, but I don't play instruments. But the discipline that you might learn from playing and perfecting an instrument could help you in the discipline of another field. That's called heuristic knowledge. Charlie Cox is a very interesting character. He passed away 2 years ago. Good friend of mine I first met him in 1998. Man, that's 27 years ago at the Dental Convention in San Francisco, the American Dental Association Convention, National Convention in San Francisco, 1998. My first mentor, Ray Bertolotti, who I had been receiving lectures from for 3 years. We met at San Francisco and we had lunch together, and he gave me a history of some of the leaders in adhesive dentistry. Now, the one that he brought up first was Takao Fusayama. So Takao Fusayama, with the invention of caries detecting dye and pioneering work with early adhesive systems with Kurare Company, Fusayama really was the father of adhesive dentistry internationally. And the second name that he gave me was the name of Charlie Cox. Charlie Cox, I did not know the name. I did not know his person, but he was giving a lecture at the convention, so I attended that lecture. I should name the other two that Ray put because it was John Kanka III and Ray Bertolotti. And so he made a nice little slide. It was a takeoff on a movie that was called Pulp Fiction. And I think there's still some people that follow Pulp Fiction. Quentin Tarantino is a director, but Pulp Fiction had 4 heads on an advertisement. Anyway, John Kank had replaced this slide with Pulp Truth. And the truth was coming from Takao Fusayama, Charlie Cox, Ray Bertolotti, and John Kanka. And so at that lecture that I heard from Charlie Cox, met him that day, continued a friendship until he died. And we were on many stages together. We had conferences where we invited him as a featured speaker. But Charlie Cox, as I got to know him, I found out that his basic personality trait was a rebel. Now, Charlie Cox was from a family of dentists. His father was a successful dentist in Adrian, Michigan. Now, unless you're from Michigan, you don't know where Adrian is, but there's a college there called Adrian College, and that was Charlie's undergraduate, and his plan was to follow his father's and his older brother's footsteps, become a dentist. But again, he was the rebel in the family. The father was successful. The older brother going to the same dental school as the father, University of Michigan. Charlie really didn't want to be exactly like his father's, but he did decide, okay, I'm going to be a dentist. And his undergraduate major was zoology. That's pretty common undergraduate major. Microbiology, zoology, biochemistry. You can have many majors. Davey was an economics major undergraduate. But Charlie didn't want to go to the same dental school as his father, his brother, because he didn't want to be, pigeonholed into, okay, here comes another Cox. He wanted to make his own way. So he went to the other dental school in Michigan, which is called Detroit Mercy. But anyway, he thought he would be better there. So he went to 1 year. But the regimentation of dental school made him crazy. So after 1 year of dental school, he quit. I can't do this. They're telling me what to do. They don't tell me why I'm doing it. I don't see a real vision of being a dentist. Anyway, he wasn't motivated. He wasn't inspired by his first year of dental school. So he quit, impulsively, not really thinking what next. But when he did come to the conclusion he had to do something, he came to the conclusion that the course that he understood and liked the most at Adrian College undergraduate was a histology course. And so in histology, you're looking at cells, you're looking under a microscope, but he actually got involved with preparing some of the slides for histologic examination. And he had a few mentors there. His main mentor in 1959 was Dr. Miles Peel. How do I know that? Well, Charlie wrote a little history of his life in adhesive dentistry that he prepared for a lecture that he gave here in Utah when we brought him out for a mastership course in Utah, 2017, 2018. When you read this history of his life, as he decided now to not be a dentist and become a histologist, meaning someone who would teach cell histology in schools, and of course the expertise in preparing slides of different tissues, microscopic investigation became part of his training. He took a 2-year master's program at Wayne State in Michigan. Then after he got his master's degree, he started looking for jobs. After you graduate from school, now I got to get a job. I've got this advanced degree. What am I going to do with it? I'm a believer in God. I think God has a sense of humor. The only job that came available to Charlie Cox was at the dental school that his father and brother graduated from, University of Michigan. So he got the job, but he's teaching hygienists. Part of the dental profession, the hygienists need to understand cells and biology, and they have to take a course in histology. And he was teaching the hygienists. I mean, this is, so funny, but he's there basically for 20 years at University of Michigan. He's making connections around the world with other like-minded histologists who are in the dental field. And during this time, dental histology actually starts to become important because we are doing in vivo research on non-human primates. I say, there's only 3 schools that I really have had intimate contact with that have done that type of work. University of Iowa, when I was interviewing for dental school, I got accepted University of Iowa, and the person who interviewed me was in charge of the monkey dental patients. In other words, at University of Iowa, I'm having my interview, I'm dressed in a suit and tie, kind of smells like a zoo where I'm having this interview because the doctor, and I apologize, I don't remember his name. I just wanted to make a good impression on him. But anyway, he interviewed me in the area where the rhesus monkeys were being kept, and they would experiment with dental materials on their teeth. And then these were evaluated histologically. And he was in connection, I didn't know at this time, with a very small group in Scandinavia, Japan, and Michigan that were doing this initial research, biological evaluation of these new adhesive materials on non-human primates. So Charlie Cox became a dentist to monkeys and did it for 15, probably almost 20 years, and became a world expert in this type of animal research. And the other leading group was in Tokyo, Japan, 2 universities there, Tsurumi University and Tokyo Medical and Dental University had monkey labs. And Charlie would go there every year. He learned Japanese. Sema Belli, that we've talked about in earlier lectures, one of the real leaders in advanced adhesive dentistry. But that's where she met Charlie Cox originally. And Charlie Cox, they did a training in Japan and stayed in contact over the years. But Charlie Cox was the first one to understand that if you're going to have success in any type of dentistry that's close to the pulp, then it's not the type of base or liner that you put on the pulp if it's a direct pulp cap. It's whether the direct pulp cap can be sealing out bacteria so that the reinfection of the pulp doesn't happen. So the idea of comparing direct pulp caps to indirect pulp caps, the in vivo research was done by Charlie Cox, Dr. Akimoto in Japan, several doctors in Sweden that I don't know personally, but Martin Brannstrom was part of that group. And then he brought money into the University of Michigan because of these research connections. And so he is bringing money into the university. But if you're a faculty member at a university and you go for a contract year to year to year, it's not real long-term security. Charlie was married, had a family at that time. He would like to have job security. So he applied for what's called tenure. And most universities have systems where when you've really proven yourself, your worth to the school, then they guarantee that you can't be fired unless you do something of great moral turpitude. So there was protections for tenure that he sought. And when he did this, he put in his resume everything he'd been doing for 20 years. And basically they said, well, you only have a master's degree. You're not a dentist. You don't have a PhD. We can't give you tenure. He was like, what? I'm an internationally known, superstar, maybe not the word, but an internationally known leader. There's only 4 people that would be my equivalent. And this field of adhesive dentistry is the future. So he tried to correctly predict what would happen in the next 30 years in dentistry. He's right at the birth with Fusayama with adhesive dentistry. He's going to Japan. He's talking with them every year in Japanese, but all of the Japanese researcher Charlie knew. And when they rejected his application for tenure, one of his friends at the University of North Carolina, who's a tenured faculty member of North Carolina, he just started laughing. And Charlie goes, what's so funny? He says, bring your monkeys to North Carolina. In 2 years, we'll give you a dental degree, and then you can get tenure at some other university. Anyway, so that's what Charlie did. He became a dental student at age 50. And he goes to North Carolina. In 2 years, they give him his DDS degree, and then he looks for another job, and he gets a full-time faculty position at University of Alabama, Birmingham. After that, he went to UCLA, and then after that, he went into the company that his son had founded, making an anti-sensitivity agent called Super Seal. Anyway, he did that for the rest of his career, but he always stayed in contact with Ray Berlotti, John Kanka, Takao Fusayama until he died, Akimoto, who's still alive, Sema Belli. His network of early researchers in adhesive dentistry was stronger than anybody, period. As he went to University of Alabama, there were politics being played. And half the faculty thought adhesive dentistry should be promoted, and half the faculty decided that it was too new, too experimental, that they wouldn't take the risk of doing it on patients in dental school. The whole politics of that, he's explained that to me. Anyway, these 2 faculty members became his enemies, and it got to be really ugly politics in a dental school. And finally, Charlie went to the West Coast, where all rebels should end up, right? Where I grew up, University of California, Los Angeles Dental School. And he was there at the same time with another European leader named Stefan Paul from the University of Zurich. So Stefan Paul and him published several papers, and University of Zurich had been always a leader and still is coming back now. It's a long history there. There was politics at Zurich. But the idea is that every dental school has different faculty members with different knowledge sets. But Charlie Cox, his knowledge set in histology made him unique. So he's got a dentistry background, but he understands the histology that has to be done to prove that our adhesive dentistry is not toxic to the pulp, which was the dogma, the myth. When I went to dental school, if you acid etched the dentin, it was going to kill the pulp. That was what I was taught in dental school. If we were using a bonding to enamel, which was taught in our dental school, all dental schools still believe the bonding to enamel is very important and doable. But at University of Pacific, we had to cover all the dentin with Dical, the worst possible selection for a liner or base, because nobody knew at that time that it dissolved under pulpal fluid pressure and became basically mush. You can get away with that on front teeth, or you don't chew on them. It's a disaster on back teeth. How many dentists have I trained who want to put Dical underneath their restorations so they don't have sensitivity? In other words, they don't understand anything about the source of pain. Charlie Cox not only worked with Martin Brannstrom, but he amplified Brannstrom's hydrodynamic source of pain into the theory that now is knowledge, that we actually know that not only do you have odontobaxic processes that are surrounded by fluid that can move in and out of the tubule around the process, but these processes have little flagella. And those flagella were discovered and named by Charlie Cox, and they're called nociceptors. And so these nociceptors were first visualized by Charlie, described. I've never found anybody that knows what a nociceptor is, because you can publish 400 papers in obscure journals that only specialists read, and they never get the knowledge to that next level of a faculty member who's not an expert, and then to a student who's just learning this profession of dentistry. But pulpal fluid movement, nociception, odontogabassic process, size, hydration, all these things that have to be done on a biochemical basis. Fusayama was the first one to biochemically break down collagen and do it with spectrometers that would analyze the sequence of the different peptides that were being broken down from the collagen proteins. I mean, it's very sophisticated science that doesn't ever start in dental school. Almost everything that's of worth in dental school started originally on somebody who was looking under a microscope, not at a tooth. But the tools can be heuristically applied to a tooth, because a tooth is a part of your body, and you can slice it thin enough and you can look at it, and then you can even go beyond that into chemistry, biochemistry, and this interaction between living tooth structure and chemical compounds, polymerizable, basically plastics. It's hard to realize how old I am, but I actually can remember things that weren't made of plastics that are now made of plastic, including cars, including golf club shafts that were always steel and made out of wood, but these polymerizable carbon fiber combinations, we actually use those in the most expensive jet planes in the world. And the things that I've learned from people who are expert in things not dentistry, but things that could be applied to dentistry, have been very valuable to me. And so the idea of a heuristic contribution from an expert in one field coming into our field, dentistry, that brings it together. But at some point, everybody has to come to terms with there's a history, there's an evolution. It doesn't all come at one time. There isn't one person that can do all the research, teach all the research, and then popularize the research. This is something that it takes hundreds and thousands. And right now we're probably getting to 1,000 people who are competent in advanced adhesive dentistry around the world. And I hope every dentist that is listening to this podcast will understand that how privileged you are, how blessed you are to be able to do what you can do. You can help so many people have better lives. And that's the whole purpose of the Hippocratic Oath, If you can't make somebody's life better, don't make it worse. So do no harm. That's the first thing, But hopefully we can all inspire each other to do the best that we can. So until next time, get bonded, stay bonded. Thanks for listening.